Taliban claimed it now controls the whole of Afghanistan, saying that they had defeated the last pocket of resistance in the province of Panjshir.
This afternoon, the Prime Minister will defend his handling of the Afghanistan crisis in a statement to MPs. And this morning, we're joined by the Armed Forces Minister, James Heappey. We're going to move on to Afghanistan in just a moment, Mr Heappey, and it's good to see you this morning. But I wonder if you are able to tell us what the situation is with the vaccination programme for 12 to 15-year-olds initially, because there are a lot of parents scratching their heads this morning, wondering if it's a choice that's going to be left to them.
Well, good morning. I think that the JCVI have come back and said that the vaccine, from a purely epidemiological perspective, is worth giving to 12 to 15-year-olds. But I think rightly there was a referral to the chief medical officers around the United Kingdom that epidemiological position should be put in the context of wider analysis of whether it was the right thing to do in terms of mental health, well-being and all the other things that would be relevant to deciding to give this to children. So we're waiting for the CMO, Chris Whitty, in the case of England, to come back with his judgment. And then thereafter, we'll have made the decision whether or not it should be offered to 12 to 15-year-olds. And like any other vaccination of children, clearly parents will be responsible for taking the decision. But I would hope that they can have a conversation with their kids that would be along the lines of, your studies are in grave risk of being disrupted. All of the activities you do in your life beyond your studies in these really important years of your life are jeopardised if you haven't taken the vaccine. So let's see what Chris Whitty says about the wider medical thing.
That's interesting, because you have just put the emphasis on the wider educational impact, or perhaps loss of education if they don't have the vaccine. I know that you're a parent. I don't know how old your children are, but would you? Do they fall into this age group?
No, my kids are 7 and 9.
All right. Sorry, Mr Heappey, just imagine if you had a child who's 12, 13, 14, 15. Would you then explain to them there is a small risk of myocarditis, or pericarditis, which is a heart condition? Would you explain that to your child and say, but you need to balance that with the fact that you might lose out on education if children of your age don't get the vaccine? Because that is the conversation parents are going to have with their teens, young teens.
Well, exactly. And that's why I think it's so important that, whereas with the rest of the population, we've kind of just taken it as read that when JCVI have said on epidemiological grounds, these are appropriate vaccines to be giving, and we've got on and done so. But I think that with children, there is a wider analysis of the benefits to their wider health, the risks to their wider health, their mental health, the risks in their sort of development as people by missing out on opportunities in school and wherever else. And that's why I think it's right that the chief medical officer is making a judgment on that wider balance of concerns, because I think that in turn is empowering to parents to be able to say to their teenagers, look, here is the analysis of the chief medical officer, our nation's most senior doctor, and this is why we think on balance it's right for you to take the vaccine. Now that will be an easy conversation in some households, far harder in others. But with the CMO's judgment and advice, the conversation is surely easier than if just relying on the JCVI and their judgment purely on
Do you find it frustrating as a father yourself and as an MP who has to offer some sort of clarity? And that Susanna and I both have boys that are within this group, the 12 to 15-year-old group, that there isn't more clarity. It would have been, admittedly, we've just had Professor Arden on who was talking about, how difficult this decision is, that they don't feel like they can recommend the rollout, but they understand there is a broader platform that needs to be explored, which is the educational side of this, and they want the government to take the position on that. Would you have rather they'd just gone, look, we can see the benefits for this, we can see why this is going to help those 12 to 15-year-olds. We can see it's going to control the surge of coronavirus. We recommend this. And then the government could have just added their support to that. It would have been a much more clear perspective, wouldn't it? Because at the moment, it feels like it's going to be the parents and the teenagers, or the 12-year-olds, that are going to be wading it through themselves.
No, I mean, I think I could argue it both ways. I could say, yeah, absolutely, it would have made sense to have had JCVI very privately make their recommendations to to the chief medical officers, for them to have made their judgment privately and then to have announced everything in one go. I can see that. But I also recognise that, the whole pandemic has been quite iterative. At every turn, we've learned more about the virus, we've learned more about vaccines. And that's meant that the sort of conversation has very often front-run policy. That's not something to apologise for. So you just have to look the public in the eye and be honest about and say that a pandemic of this scale, where government has had to problem solve through policy in real time, where science has been developing vaccines and understanding the power of vaccines in real time, means that you don't always get to announce things on your terms. But I think it's important that the public see the working. I'm explaining it as best I can this morning.
Yeah, a fiendishly difficult conversation for parents to have with their children, I think, if it is the case that it is rolled out. Let's talk about Afghanistan, because the Prime Minister is going to be in the House of Commons today to defend his handling of it. We spoke to an interpreter who'd been working with the British last week on this programme, who was in hiding. He's trying to get out of Afghanistan. He's been given permission, but, there's no way for him to get out right now. He's still waiting on instructions from the Afghan Relocations and Assistance group, the government group, which is supposed to be helping him. Why have we left these people behind, and why have we let them down so badly?
Well, look, the sad reality of the whole evacuation effort was that there would always be a requirement for one more flight, and we would always run out of time. And that's why I came on your show on a number of occasions. So too did my boss, Ben Wallace. And we were brutally honest with you about the reality that not everybody would get out in the airlift. Now, how we get them out now that we've gone is what we are putting our minds to in the MOD right now. That the easy option may be if it turns out that the Qataris, for example, are able to get the airport in Kabul up and running, and aircraft are able to fly in, and we're able to put people on there. But that is much more easily said than done. We're in negotiations with neighbours in the region, principally Pakistan, but Uzbekistan, Tajikistan, Turkmenistan as well, in order to look at how we might be able to bring people out over their borders. But the reality is that what I don't think we can do is say to anybody right now, here is a safe route to the border, here is safe passage across the border, and then from there, obviously, everything is in our gift about how we would get people back to the UK.
I wonder how that makes you feel personally, because, of course, what we are talking about, and Saeed was the person that Susanna's mentioning there that we spoke to on the programme, somebody who had worked with our armed forces and had worked for many years to support our armed forces in what they were trying to do. How you feel, because I imagine that there are people that you have experience of, people that you know have been there and been through this and may well have been left behind. How you feel personally about the withdrawal of our forces, how that happened, how quick that was, and as Susanna said, all these people that have been let down.
There's a book in the answer to those questions. On how I feel about the fact that we've left in the first place, I think that absent from the debate far too much has been the reality that the Doha agreement that President Trump signed is what enabled us to have only a few thousand troops all up from NATO in Afghanistan over the last couple of years. So it was never a choice between that status quo and leaving. It was always a choice between whether we wanted to fight the Taliban again, with all of the misery that would have brought and cost in lives for UK, American, NATO armed forces, or leaving. And it's important, I think, that people frame the debate in that way, because that was the reality of the policy decision that President Biden and other heads of government around NATO had to take. How do I feel about the fact that we've left people behind? Well, utterly miserable. I mean, we were working night and day for the duration of the airlift to get as many people onto planes as we possibly could, but we knew that there were always going to be people behind. I feel quite strongly that we shouldn't be, for the sake of the sort of optics to the UK media and public sort of rushing to say, right, move to this border post right now, because we don't know for sure that that's safe. And I would far rather that our advice was stay hidden somewhere that you think is as safe as you can find, whilst we work with our colleagues in Tashkent, Dushanbe, Ashgabat, Islamabad to come up with a solution with partners in the region, and then we can contact you and give you some authoritative advice, rather than risking sending people to their deaths by going in half-cocked.
I know that the government is going to provide more money for charities supporting veterans, and you've also been in a very uncomfortable position this morning where you had spoken on one broadcast outlet about the impact of what has happened over the last few days on those who have served and an individual who you believe might have taken their own life. It's an incredibly sensitive subject. Is it the case that that has happened?
Well,
have you seen evidence that what has happened since our withdrawal has had a devastating mental impact on those who served in Afghanistan?
So a suicide note was shared on social media at the back end of last week, which referred in very, very accurate detail to the last tour that I served on, which was with 2 rifles in Sangin in 2009. And I've spent the whole weekend, because it lays the blame at the words of politicians in saying that this wasn't all in vain. I've spent the weekend thinking that my words on this subject might have contributed to the suicide of a colleague. After saying that on Sky News this morning, I was told from a number of people that contacted the MOD press office, and there was an awareness, I think, already within the MOD over the weekend, that potentially that suicide note might not be real. I'm deeply embarrassed to have reflected on something that I had seen on social media and struck me as very true and had affected me deeply. But if you don't mind, I sort of, whether that note is accurate or not, and the Army and the MOD are working hard to find out whether it is real or not, there is right now a very real danger that, as a consequence of what people are seeing in Afghanistan, veterans who serve there might be questioning whether they should go on living. And there have been far too many suicides within the veterans community over the last 10 years from people who were deeply, tragically affected by what they saw in Helmand during their service. And so, if this is another opportunity for me to be able to say that your service was not in vain, what you did, you should be proud of. Everything that has happened 10 years later is a set of political decisions made in Washington, London, Berlin, Paris, over which you had no control. You served on your tour with great honour, great courage, great sacrifice, and you must be proud of that. And if you need help, reach out for it. Government is putting money into veterans' mental health today. Veterans' charities are there to support. Regimental associations are there to support. Communities will want to put their arm around veterans within their communities today and over the weeks ahead, because this is hard for them. And, I'm sorry if I reflected on something that was inaccurate, but the message underneath it was very real, and we should all take very seriously.
And what you've just said is hugely important as well. We'll just help there as well, because if you have been affected by any of these issues that we're discussing, there are, as James Heappey is saying, organisations that can offer advice and support. If you go to our website, we will put all those details on there as well, James Heappey, because I think, sort of echoing what you've said there, that we don't want anybody to feel like there isn't an option or some help out there is hugely important.
James Heappey, thank you.
That's really appreciated. Thank you.
Yeah, thank you very much indeed.